Playing with heart. At a time when young athletes push their bodies to the extreme, sports cardiology is critical. And for one college athlete, it saved his life. Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. If you're a parent or a grandparent or a young athlete, you want to watch this. Strong bodies don't always mean strong hearts. The player you're about to meet knows this firsthand. When Gavin Schlotterbeck arrived on campus at KU in Lawrence to start his baseball season, he underwent a physical, during which he got a scan that's not offered everywhere. That scan detected a problem that could have turned deadly.
My ascending aorta, it was incredibly enlarged to where it could have just ruptured, and I could have died 30 seconds once it ruptured. But they said the typical one's like 2 centimeters in diameter, and mine was pushing 7. And I said that's the point where it's like catastrophic and you need surgery like right away. Hearing this, it hit me like a truck. I was like, I didn't know what to think or how to function. I was just sideswiped by it.
Understandably, you think you're in the best shape of your life and you hear that news. It led to open heart surgery, then rehab, and then ultimately a comeback to the sport he loves.
I don't think it's a stretch to say that Gavin's life may have been saved by a scan it's not offered everywhere. I mean, I think of all the places I've coached where this wasn't offered.
I'm incredibly grateful. I mean, every day I wake up, I'm thankful to be here because I know I could not be here right now, and that's something I've learned to not take for granted. It's just to enjoy every moment of the day, and every time I get asked like how I'm feeling or what I think, it's just happy to be here, happy to be able to play baseball again.
This morning, we hope as Gavin shares his story that it's a real wake-up call for every young athlete and their parents. This is always an important conversation, but especially now with spring sports underway. So we're going to really dive into it this morning. Joining us now are 2 sports cardiologists I'm so happy to have on the set with us this morning. We have Dr. Tim Beaver. Thank you for being here. And Dr. John Fritzland. Thank you for making time. And hopefully joining us virtually in just a little bit from Lawrence, we'll have our KU baseball player, Gavin Schlotterbeck. We're working on his signal right now. He's made time to join us this morning, so hopefully the technology gods cooperate. This scan that Gavin had while we're waiting for him to connect is a scan that's not offered everywhere. What kind of scan would detect something like this, Dr. Beaver?
So this specific condition, an ultrasound of the heart is what we use to scan to look for this particular thing. It's part of a screening program, but it's not necessarily offered to all athletes, and there's reasons for that. Obviously, you're not going to take the 50 million high school athletes in the United States and be able to screen all of them. So there are different tools that we use depending on sort of different age groups and different levels of exercise and sport. But it really depends on sort of where you're starting out to get through the screening stages to get to a point where you're trying to understand if there's a risk for the athlete.
So Dr. Fritzland, we heard at the beginning of the video that this scan is important. It detected something so serious. How common would it be that an athlete of this caliber would have a hidden heart problem?
It's pretty rare to see at this stage. I think as Dr. Beaver and I were kind of thinking back to the last 5-10 years that we've been doing this, that he's been doing this, I think we've picked up 1 or 2 in that 10 years that have been kind of a life-changing sort of pickup. And sometimes symptoms show up and then we detect it, but for that to be the first time that we detect that without symptoms, it's extremely rare.
And are the scans, for example, that Gavin got, would this be something that he gets, he arrives on campus and undergoes all these scans specifically dictated by cardiologists like you, Dr. Beaver? How does that work?
So many of the sports programs, because as the intensity of athletics sort of picks up and you get to collegiate and especially Division I and professional athletics, the risk, because you're pushing yourself more and more, sort of you can have physiological adaptive changes that occur that are positive for you, but that intense exercise, the more you push yourself, can unmask sort of hidden heart problems or acquired heart problems. And so there are times when you get to that level where universities and teams invest in those screenings and they engage sports cardiologists to sort of help make sure their athletes are safe, because they're going to be putting themselves through such intense training and sport.
So what Dr. Beaver is saying is this might have been something then, some people might live with this undetected, but it came to the surface more like peeling off layers of an onion quicker because of his physical activity?
Right, and the fact that he was in a collegiate sport where we would have done that screening allowed that sort of situation. Otherwise, I think if he wasn't in sports and was just going on about his normal life, I don't know if he would have had just any sort of routine EKG or echo. It probably would have gotten to the point where he was having symptoms which would have led to the ultimate diagnosis, and hopefully before something catastrophic would have happened. So
you were the one that first told me about Gavin, I believe. You said you've got this athlete. When you met him, what did you think? Is he someone that looked like, oh gosh, this guy would be at risk?
No, he just looks like an average college student.
Right.
That's what makes this, difficult. And just to be clear, right, this is sort of a strike of lightning event, right? Like he said, we picked up 2 people in the last 7 years that have had something that was life-altering. Either they were disqualified from sport or for a short period of time. Gavin, obviously, we love the story because we were able to intervene and have surgery on Gavin, get him back to playing the sport that he loves. And that's really the intent of a sports cardiologist, right? We do this to try to make sure people are safe and come up with good plans for them so they can continue to enjoy the sports that they love in a safe manner.
Without revealing any HIPAA or identifying information, the other event 7 years ago, it was also a college athlete?
Yeah.
And you revealed something that
it was something else we saw in screening, yeah.
And what was the exact name of what Gavin had?
He had an aortic aneurysm.
Okay, and we've heard of those.
Yeah.
So, Dr. Fritzland, at what point in your medical career did you decide to get into sports cardiology?
So I was early on into cardiology training. I was spending a lot of time with Dr. Beaver. I grew up playing sports and played, like many people, like 2 sports every single season, and really enjoyed athletics. The confidence it provides athletes in terms of social construct and physical and emotional sort of benefits, and really enjoyed being a part of athletics. So when I started spending time in cardiology fellowship, working with Dr. Beaver, realized, hey, there's sports cardiology, there's this whole field that focuses on kind of the care of athletes. So I was immediately drawn to that, and then spent more time going to conferences during fellowship, doing screenings with Dr. Beaver at our collegiate and professional level, and then did extra training after fellowship with another sports cardiologist. So it just ultimately led to this, and thank Dr. Beaver for that.
Did you say you were both college athletes? Did you say?
No, I was not.
High school athlete?
Yeah, high school athlete.
High school athlete, and then
recreational.
Yeah.
I did.
What sports did you play?
Swimming was my main one. I did cross country and track for a little bit as well.
And what about you?
Everything growing up besides hockey,
Super
probably,
active.
which is why my son was a college hockey player.
Oh, your son was a college hockey player? Time out. What college? That's awesome.
He was at St. Michael's. It's in Vermont.
Yes.
Yeah.
Oh, that's neat.
Yeah.
So you did a lot of traveling.
Yeah, and it was during COVID, so there was a lot of questions for me during that time.
Oh, geez. Well, that's really interesting. What is it about the heart of an athlete that makes it more unique for someone to be looking at? Is it because they're pushing it to the extreme?
Right. Once you get to that point when we're in more the collegiate level, even sometimes earlier, that all that intense training, the heart has to adapt to the high work levels, the high sort of endurance training. So we can see it changes in ways that is adaptive to the sport, but it can also appear like certain pathologies or certain abnormalities of abnormally thick hearts or dilated hearts. So there can be some gray area when athletes train so hard that the heart has kind of changed in a significant way that we have to kind of tease out whether or not this is just all from their training, or could there be something more that we need to be concerned about.
And that's really where the sort of the sports cardiologist fits into this equation, right? Because that overlap between normal physiologic change and disease, there's an overlap there. And so you being able to be the expert and differentiate that overlap,
right,
so that you don't unnecessarily restrict an athlete versus catch something early.
So what would have happened if Gavin was playing at a different school that didn't have this partnership and this collaboration with these scans available that you do?
I mean, obviously something bad could have happened, right? Like, we don't know what would have happened. He's an otherwise young, healthy man, but the risk there, as we've talked about with aortic aneurysms, they're sort of like a balloon. The bigger they get, the thinner the wall gets, and the risk of rupture goes up. And so clearly he was in that window to need a surgery,
oh my gosh,
as any person that would present would be. So. And
we have some video of Gavin as he was up and walking. I assume that you get them walking pretty quickly after their surgery.
Yeah, no, for sure. I think the rehab portion, not only for him just because he's an athlete, but for everyone, you're not in that position too much post-op. You get up pretty quickly and they start moving you around, because that's what the body responds to. It just gets weaker if you sit still. So
use it or lose it.
Yeah,
we
exactly.
hear doctors saying that all the time. And we're still working to get Gavin connected with us. I sure hope he can join the conversation, because we have so many questions for him. I'm going to toss some of the questions I had for Gavin to you, doctors, but if you don't know the answers, that's okay. These were meant for Gavin. I wanted to ask Gavin about cardiac rehab and what cardiac rehab looks like for a high-level athlete.
Yeah, it's a tough one, right? So, and it's not just Gavin, it's any sort of younger person, because although heart disease, if you look at the demographics of it, most of the people that are getting this type of open heart surgery are in the older age groups. So you have a very different population that's usually at cardiac rehab, but cardiac rehab also gives personalized plans, right? So Gavin comes and he's not going to be given the same plan as an 80-year-old person that had coronary bypass surgery,
sure,
right? So you're trying to push him a little bit more. At some point, he has to be released back to his trainers at the university to sort of say, okay, constant conversation with the sports cardiologist. He graduated from cardiac rehab. Now his rehab continues, but it's more focused on, yes, I'm an athlete and I'm going to start pushing myself to get back to that level.
And so, Dr. Fritzland, when did you meet Gavin for the first time?
So I haven't met Gavin in person. I was supposed to be at that screening that day, but I think it was in New Jersey doing a sports fellowship and kind of.
He was screened in New Jersey?
I was in New Jersey at the time. I was supposed to be in Lawrence that day.
Yeah.
So I haven't had a chance to meet Gavin yet.
Yeah.
So
how does it work? You travel to Lawrence and you
so
the athletes?
We have it both, right? So we have sort of basically 2 big screenings a year in Lawrence, and then other times we have athletes that come in off cycle that we will send people there to screen, and then I look at all their stuff and make sure it looks okay. But those days, like in August, we do 100 athletes in a day.
Wow.
In June, we do like 50. So that time we have, usually the second cardiologist when there's 100 people, but we're going through and screening everyone that's coming in at that time. And so it is hard, it's hard on multiple levels, because going in for that patient/athlete whose parents just dropped them off, they're 18 years old.
Right.
They've been there for a couple days, they're with their peers, and then you find something and you have to pull them away from your peer group, and it's hard on multiple levels. It's way harder on obviously the parents that just left their kid and the kid, but it's also hard on me. It's like, it's not an easy conversation to have.
They probably feel like they're your kids too.
Yeah, no, it is.
And you have a student athlete, a son that was an athlete, just like Gavin.
No, I take it very personally, right? Like, I lose a lot of sleep over making sure that I do justice for the athletes and walking that line to make sure that they can do what they want to do, but in a safe manner, for sure.
And so how many schools is the University of Kansas Health System in the sports cardiology department? How many schools are you going to in scanning? Is it a pure partnership with KU?
Yeah, from a collegiate standpoint, it's a pure partnership with KU. We see a lot of other Division II and III athletes throughout the Kansas City area and the state of Kansas, for that matter, to screen them, if they have issues. But our partnership is mainly with the University of Kansas, and then, of course, we have our professional partners in the area as well.
So a little bit about Gavin Schlotterbag. He's such a sweet kid. I say kid, I think he's 19 or 20 now. He's a sophomore, but he was starting his sophomore year at KU. As Dr. Beaver said, parents just drop him off. It's August. It was this August that this happened. Yeah. So not long ago, goes in for the scan. He's a pitcher and a catcher, and it was detected in August. Then when was his open heart surgery?
In September.
So right away, right out of the gate, he goes for open heart surgery. How long was Gavin here then in the hospital?
He was in the hospital for about 5 days. So, which is pretty standard, you know, you're like getting up around and you come out of the operating room, you've got a lot of tubes and stuff like that that you gradually get removed as you're sort of rehabbing and get out of here. And then I think his family stayed up with him for quite a while during his recovery phase. And then, you know, we see him back about 3 months and do scans and sort of assess his cardiac rehab and then talk to his trainers and try to get him back moving again. And he's back playing baseball.
Do you remember the conversation with Gavin's parents? What that was like?
Yeah, I do.
Can you share a little bit about that?
Yeah, you know, it's really of trying to assure them, because I get it. I'm a sports parent, right?
Was it in person, or you had to call them and say, "Oh, hey, you're home now"?
A lot of times it's Gavin, the trainer, and the parents are on the phone. So, but you're having the conversation and saying, you know, trying to reassure them, to make them understand that, you know, you pulled him away from his peer group. You wouldn't have done it without good reason.
Right.
That there's some dangers there. Try to sort of explain the condition that he has. And then before that, right, I have a path for Gavin, right? This is, most people have a path of, okay, this is what Gavin has. This is what we can do to repair it. And this is what his journey looks back as an adult, right? Because that's the most important thing. Just sort of living life in general,
right?
But he's very focused on athletics, and that's important to him. And sort of this is his path to get back there.
Dr. Fritzlin, Gavin said he was cleared. He was officially cleared to do everything in January. So open heart surgery in September, cleared in January. How typical is that trajectory after open heart surgery to be cleared to going back to playing a sport at the collegiate level?
That's our goal.
Yeah.
Is certainly want to make sure that the sternum heals appropriately. Don't want to have any sort of issues with that, and allow that to heal. That's probably one of the biggest kind of concerns. And then able to assess that he's able to tolerate activity, get him, you know, he's done his cardiac rehab. Dr. Beaver's reassessed his physical condition, make sure he can tolerate all the things that his athletic trainers are going to be putting him through, going over kind of any sort of modifications or just awareness with, you know, weightlifting and such, given kind of his repair. So that's a couple months is kind of what we shoot for.
You hope for that.
But you know, we sometimes moving target, but we'll stay flexible. But that's the goal.
I love that that's the goal, because I was thinking that was a really speedy recovery, but you're saying that's your typical goal.
Yeah, no, is to get them back at the appropriate time period and make sure they're safe, right? And we do scans and stress testing to sort of make sure that he's in the place that he needs to be before he starts doing more intense training. So, and then there's a communication piece, which is why our integration with the University of Kansas is important in the athletics department, is they have direct access to our team, and we have the communication sort of cadence that we have with them to make sure that we all know what's going on with the athlete.
I just have a personal question. Knowing what you know now as a sports cardiologist, and then looking back and seeing how your son was an athlete, were you a sports cardiologist while your son was an athlete?
Yeah.
So you were able to request those scans and do those?
No, I mean, again, he went to a Division III school, right? So not everybody does that, right?
Did it make you nervous? No, as a doctor sometimes.
No. I mean, as a cardiologist, right? I don't. That's the thing, right? I know this is a lightning strike event, so the averages are, most athletes that are out there, if they're not having symptoms like chest pain, shortness of breath, feeling like they're going to pass out with exercise, feeling their heart race inappropriately, that if they're involved in their activities, they're not having any limitations on what they're doing, they're probably safe, right?
Yeah.
So I think, you know, we were going to, part of the questions is what's important, right? And the average athlete is, you know, some people give lip service to that sort of yearly physical that their kids usually have to sign the form like it's a task that needs to be done, but it's really the opportunity to talk to your doctor to make sure if you have any family history of heart problems at a young age or inherited heart problems, if your kid's having any symptoms that you're concerned about, and for the doctor to examine them for heart murmurs to make sure that there's nothing that's there that would actually get them to the next level of testing. So that history and physical is really important. And so for the general public, I really think that that's what you should focus on. And so I, in my heart, knew my son, you know, was a normal sort of active person, wasn't having any problems. And so I was comfortable with the situation. So it's really, it really depends. Everybody sort of approaches this a little bit differently.
And that's a
from
good
a collegiate
point.
standpoint.
About not just treating the yearly physical as just a task. Like, here, can someone please sign this? I got to get this done.
Right.
We have also a pretty surprising statistic. It might surprise you. It surprised us. When it comes to cardiac events that are just sudden, like a cardiac arrest, only 1 out of every 10 people who has a cardiac arrest outside of a hospital survives. 1 out of 10 survives. Athletes are no exception. So what would happen if there's a cardiac arrest that happens, God forbid, during a game at the collegiate level? Do you just depend? Is it just depending that? Does it ride on someone knowing what to do at that moment to help them? That they're being a doctor or a nurse,
or just a coach or a trainer? So the number of events over the years really haven't increased per se, but our awareness and our response has gotten better. I think our actual chances of surviving a cardiac arrest have been improving over the years, that we're more aware of how to respond. We have better access to AEDs. We have emergency action plans. And then, at least in the state of Kansas, that athletic trainers, coaches should be CPR trained in AEDs, because those are going to be some of the first people to respond. You may not have a doctor sitting out in the stands who's able to get there first, but it's really that first contact that is the most important, and that could be a coach, trainer, or even fellow athletes who can be there, kind of wave people over attention, start CPR. So it's important for people to be aware, to have these plans in place, and also coordinate with local emergency responses. So that's a part of an emergency action plan. If we identify an athlete who may be at risk but who we think is still safe to play, we talk about with the coaches, hey, we need supervision at practices. There should be emergency action plan coordination with local EMS should anything happen, and that should be practiced yearly and run through. So it's not just a piece, a plan that sits on a piece of paper. It's
laminated on top of the AED.
It's an action plan, so should be practiced.
Well,
so
that figure you gave is low, but part of it is access to AEDs, right? So the whole goal is to have, if you go to high school gyms and now you see AEDs, is right to defibrillate somebody within 3 minutes. If you do that, the survival rate goes up to almost 80%.
And a lot of that's due to the partnership we have with high schools in our area here, the health system partnering with
Exactly, and that's why we advocate for learning CPR in school, like high school.
So it's important.
Yeah, because the more people in the crowd that are trained to use an AED and know CPR, the better off we are.
I always thought that should be part of a course in high school. We learned a lot of things that I don't need at all. And one of the things that I wish they had taught was, there's a lot of things you wish they'd taught. One of them is CPR. I wish that there'd been that was a full course of how to just handle emergencies when you're out and about.
Absolutely.
We have some questions coming in from the community, so I'm going to get to those. Feel free to send us your questions, or if you have a comment you'd like us to read out loud on the program, you can send them to YouTube, Facebook, or the All Things Heart email. The links are right there on your screen. And again, we're really hoping Gavin can join because he has such a remarkable story. We're working on that connection. Before we get to Jeremy Yenser's question, he's one of our viewers, I want to ask both of you about the emotional component of this, because Gavin said he felt like he was hit by a truck. And understandably, you're going in, every kid feels like they're immortal, but then when you're an athlete at that level, you don't expect to be told you have a potentially deadly heart condition. What are the mental health resources that are offered or that you see they need, just as a human being, when you see that fear in their eyes?
Yeah, I mean, I think the good thing is most major universities with these sports programs and these young people have actually a tremendous number of mental health resources. So I think this specific situation, I think it would shake anybody. But if you listen to, if you heard part of Gavin's interview and his coach, that's just the kind of, these athletes, that's the kind of person they are, right? Like he is, like, what do I have to do to get back, right? I'm he of all emotions I'm sure he was having. I'm scared, afterwards he woke up, oh my gosh, this is the weirdest situation, right? I'm in pain, all this stuff, but then,
strange.
his sort of personality as an athlete takes back over and sort of pushes him to say, what do I need? I need to go to cardiac rehab. Tell me what I have to do. I want to get back to playing baseball. And that's what's great about, you know, people that enjoy athletics or want to push themselves, is usually they're able to recognize what the positive aspects are of their sport, and that actually helps their mental health too, because that's part of what they enjoy. Yeah.
We have a question from Jeremy Yenser, so let's get to some of these community questions. Jeremy wants to know, are athletes' hearts different than typical hearts? Like, do they tweak and adapt to the strains and efforts, or are all healthy hearts pretty much the same? Dr. Fritzlin.
So in elite level athletes, there is change of the actual heart. They can dilate, they can thicken based on the sport that they're doing. If, say, they're like a weightlifter and dealing with a lot of resistance, powerlifting, the heart might get thicker and stronger in that way. If they are a cross-country runner, a triathlete, something that involves a lot of endurance, then we might see those hearts get dilated, because heart needs to pump more blood to keep up with the demands of that sport over long periods of time. So, you know, their hearts are, I think in some of the elite level athletes, are able to remodel or changes maybe in more ways that allows them to be successful. But you know, their normal hearts, they've just been able to accommodate to the demands of the sport.
Sean has a question, and Dr. Beaver, I'll direct this one to you. Sean wants to know, should all youth athletes get screened by a sports cardiologist? At what point should a parent recommend or ask for their kid to be screened?
So I don't think every sport, you know, again, I would love seeing patients, but I don't have time to see every Kansas City kid, even high school kid in the Kansas City area. But it's really not about the mass screening. It's really more, again, I'll sort of redirect you back to what we were talking about before, whereas that conversation with your physician and that yearly physical is the important part, because it actually puts you as a parent in a mode of asking your kid questions. Are you having any problems at practice? Are you having any chest pain, shortness of breath, feeling like you're going to pass out? You know, do we have a family history of any problems that would warrant us to be concerned? And if those things come up then, and you know, there's a concern there, then moving to the next level of testing or seeing a sports cardiologist is when it becomes necessary.
That touches on something. There's not enough of you guys. We need to quadruple, quintuple you. So in a perfect world, if you got a wish from a genie on what would be universal for every young athlete to get, what kind of test, and it wouldn't require making 100 more of you doctors, what would the test be that you would hope every young athlete would get universally?
Well, I think still not to just kind of underplay the importance of that, you know, personal, that pre-participation examination. That
in the physical.
That is still the best, you know, kind of broad or general sort of recommendation we can do. The EKG is controversial. It can detect certain things, but that can change over time. So even then, we don't always pick up on things in the moment, and that can have false positives, create create more kind of stress and kind of cascade testing when it doesn't lead to any sort of difference in pickup. So really have to stand by that pre-participation exam, a good family history, without kind of with acknowledging that there are tests available, but there's caveats.
So don't bypass your family physician and your general practitioner.
And
they can save lives.
Right,
it's a
and
crucial role.
some of the unique sort of setup that we have, at least at the university level, is we're right there to interpret and provide recommendations. The situation that becomes challenging is if they're seeing a pediatrician who's not a cardiologist, they get these abnormal tests, they're not quite sure what they mean, and then like, okay, we'll send you somebody else. It could be weeks or months before they're evaluated, and they're left with all these questions. We're able to talk with the athlete right then and there, get all the information in front of them, talk with their parents, and really kind of put to rest some of those, you know, immediate questions and help kind of talk them through that.
So I mean, it's just to drive it home, sort of, it's a bookmarking of appropriate screening and emergency action plans, AEDs and CPR, right? Like those are the cornerstones of this, is that we can, even though all the people we screen, it doesn't, you know, things we don't find everything that
Right.
possibly could happen. So what's really important is to understand sort of the warning signs on the other end and having those action plans in place, or having people that are trained in CPR and having AEDs available so that when things do happen, then you can intervene, and then like Damar Hamlin, who we've
Yes,
talked about
that was
before,
so
that everybody
scary.
saw on ESPN, that arrested
live
on TV,
during the game.
is that you have somebody that's trained in CPR and AEDs, because that's really what saved his life, to get him to the to the
It
hospital.
sure did. Boy,
So-
that was a wake-up call. I bet your phones were lighting up from all your friends asking, what's your take on that? What's your take on that? What happened?
Yeah.
Thank God he was okay.
Yeah.
Well, Dr. Beaver and Dr. Fritzland, thank you so much for taking the time to join us. And we'd
you.
hope to have Gavin join us this morning, but we can't control technology. It kind of bites us when we least expect it, but we do appreciate him wanting to join us, and thank you to KU for sharing that video with us as well. If you would like to watch or share any one of our previous episodes, just scan the QR code on your screen. It will take you to a list with links of all of our past episodes. Also, coming up tomorrow, we have another timely sports show. We're going to check in with other young athletes and focus on the training and the best way to protect them while they train. We're going to follow a student as they keep their body ready for a new season. That's tomorrow at 8 a.m.